Well, no, you don't have to do that. You can put it in an endoscope and get a hook and cut it that way. But we're going to say you don't have to do either of these. Next. Because we have the age of ultrasound. We can find the ligament right here. Next. And one way we can do it is we can take a needle and loosen the ligament and do a hydrodissection, which I'll show you now. Next slide. So here's the ligament pushing on the nerve. Next. Start this video. We can take the needle and repeatedly puncture the ligament to loosen it. Next. And then once it's loosened, we can do a hydrodissection. Start the video. And here I'm dissecting the ligament off of the nerve and the tendons. So this is something we did for quite a few years. But now we have a better way, so I'll show you in a minute. Okay, next. So this was right before the hydrodissection, and then next slide, right after taking the needle out, you can see that the waist of that nerve is gone and the nerve is sprung back to its normal caliber. Next. We can also use this for recurrent carpal tunnel syndrome as well, but let's skip to 2 slides from now. Okay, just so our preliminary results in 2012, just with the needle technique and the hydrodissection, next, is that, go through this, we looked at 17 patients at that time, mean follow-up 2 years, and even after mean 2 years, they had significant improvement in their pain and functioning. And so we knew we were on to something, and so we started doing this as a regular technique that we offered. Next. But then people started taking it further. So there's a paper by Petrova and also Rojo Manuate. These investigators are looking how to do a classic surgery through the skin. Next. So this was a prospective study, 129 patients who had CTS for more than 6 months, EMG confirmation, and they had failed medical treatment. Next. So they used this setup right here, and this was the hook that actually cut the ligament at the bottom. Next. And they used the ultrasound to guide the hook into through the palm and under the ligament. Next. And then they were using the transverse safe zone, which is this area right here, and they were cutting the ligament. Next. And the results were terrific. Significant decrease in symptom and severity scores. MRI confirmed complete decompression at 100%, and they had no complications. Next. Okay, so then a company called Sonex, which is developed by physicians from the Mayo Clinic, said, well, we have a way that we can do this now. And they developed this tool. And this is what I actually use in my practice now. Next. So what we do is we place this tool into the carpal tunnel, into the safe zone between the median nerve and the ulnar artery. And you can see here's the device in long axis under the ligament, TCL. And first we take the device and we move it back and forth to sort of break up the adhesions under the ligament. Next slide. Then we deploy a balloon. The balloon pushes the median nerve from the hamate bone and gives an extra safe zone for the procedure. Next. Then we start to deploy the needle once we're sure that there are no structures in the way. We identify the recurrent motor branch, all the arterial branches, and other nerve branches. And here's the needle in a cadaver, the hook in a cadaver. And there it is. You can see it coming out and starting to cut the ligament. And then we just move the trigger and cut the ligament all the way through to its beginning. Next. Then we take the probe and we make sure that we did a complete cut. This is an incomplete cut on the left side. You can see that it's looser but doesn't go all the way through. So you can do it a second time, and when we did this one a second time, you can see that it came all the way through. Now it's completely released, and we just wrap a cling wrap around the hand for 2 days, then they can take it off. They have a little Band-Aid on, and we tell them they can use their hand immediately. We see them back at 2 weeks for follow-up. And if they're perfect at 2 weeks, there's nothing more to do. If they still have symptoms at 2 weeks, we bring them back at 3 months. Okay, next. And this is what they look like at 2 weeks. Okay, this guy tried to play golf before I even saw him. Next. So the preliminary results, the first case was performed in 2017, so 1 year results. Now that we're over 500 procedures, 23 different users in 13 different states in the United States, including all different specialties as listed there. Okay, next. And there are no reported neurovascular complications, no reported device-related complications, And the clinical results are very comparable to what's been reported for ultrasound-guided carpal tunnel release that other authors have shown. I personally have done 18, and they've gone great. We have some very satisfied patients. Okay, next. So in conclusion, ultrasound-guided release is safe and effective for treatment of trigger finger, carpal tunnel syndrome, tenotomies, as I've shown you, plantar fascia. Exact procedure details and equipment will vary over time, but the take-home message is ultrasound-guided surgery is here to stay. It's a very exciting field, and all of us in this room and elsewhere need to grow it as far as it can go. Okay, thank you very much.